Anxiety is, well, a natural response of the body to stressful situations, but when it becomes persistent or, debilitating, it can really interfere with the quality of life. Here's a complete overview of what anxiety is, its causes, and, how to manage it. What is anxiety? Anxiety is a feeling of worry, nervousness, or fear, which can range from a normal and temporary response to stress to a chronic disorder that affects daily life. It manifests both mentally and physically. Physically, it can cause an accelerated heart rate, sweating, trembling, muscle tension, and honestly, difficulty breathing. Mentally, it translates into worrying thoughts, a sense of inadequacy, or fear of future events. Main causes of anxiety. First, biological causes. Genetics. If you have family members with anxiety disorders, you may be genetically predisposed to develop it. Neurotransmitters. Imbalances in the levels of neurotransmitters such as serotonin, dopamine, and GABA can affect mood and anxiety levels. Hormones, hormonal changes, such as those related to pregnancy, menopause, or thyroid problems, can increase susceptibility to anxiety. So, let's talk about some of the psychological causes of anxiety. Past trauma, like, traumatic experiences such as abuse, accidents, or grief, can really trigger or increase anxiety. Chronic stress is another big one. Everyday stress, whether it's work difficulties, family problems, or financial issues, can actually lead to anxiety disorders. And then, self-criticism and low self-esteem, negative thoughts, and being overly harsh on yourself can definitely fuel anxiety. Moving on, there are environmental causes as well. Stressful events like major life changes, losing a job, going through a divorce, or significant transitions can trigger anxiety. Social or global uncertainties are also important to mention. Concerns about global events such as pandemics, wars, or economic crises can increase collective anxiety levels. And of course, there are physical or medical causes too. Certain diseases like diabetes, heart conditions, respiratory issues, or thyroid dysfunctions may present with anxiety symptoms. Plus, certain medications or substances, such as caffeine or alcohol, can also cause or make anxiety worse. Now let's look at how to manage anxiety, especially with psychological strategies. Cognitive behavioral therapy, or CBT, is one of the most effective therapeutic approaches out there. It helps individuals identify distorted or negative thoughts that fuel anxiety and replace them with more balanced and rational thoughts. Mindfulness and meditation are also really helpful. Practicing mindfulness helps you focus on the present moment, which reduces anxious thoughts about the future. Then there are relaxation techniques like deep breathing, progressive muscle relaxation, and yoga. These can reduce both physical and mental tension caused by anxiety. And finally, gradual exposure is another strategy. If anxiety is related to a specific situation or phobia, gradually and in a controlled way, exposing yourself to the feared situation can reduce symptoms over time. So, let's talk about physical strategies for managing anxiety. Exercise is honestly one of the best tools out there. Activities like walking, running, yoga, and swimming can release endorphins, which, really help improve your mood and reduce tension. And, sleep is absolutely essential too. Getting enough rest helps rebalance both your body and mind, making it easier to reduce anxiety. Another thing to keep in mind is a balanced diet. Eating foods that are rich in vitamins, minerals, and omega-3 fatty acids helps maintain the proper neurochemical balance, and that may actually reduce anxiety. Oh, and avoiding excess caffeine and sugar is also really helpful, just to prevent stimulating more anxiety. Social support is, really important. Talking to friends, family, or even a therapist can make a big difference. Sometimes, simply sharing your concerns helps reduce the emotional burden. Setting boundaries is key, too. If your anxiety is related to a stressful work environment or just a hectic life, it's important to set clear limits to protect your mental well-being. Taking breaks and spending some time for yourself is, honestly, essential. Now let's talk about medical treatments. In some cases, doctors may prescribe medications like anxiolytics or antidepressants to treat acute anxiety symptoms. It's essential to follow your doctor's instructions and really not to self-medicate. Sometimes, a combination of psychotherapy and medications can be helpful for treating more severe anxiety disorders. So, when should you seek professional help? Anxiety is a normal response, but if it becomes chronic, intense, or, debilitating, it can develop into an anxiety disorder, like generalized anxiety disorder, obsessive compulsive disorder, panic attacks, social phobias, and so on. If your symptoms are severe, or just do not improve with management techniques, it's important to consult a mental health professional for an accurate assessment and treatment plan. In conclusion, anxiety is a natural part of the human experience. But if it's not managed, it can negatively impact your quality of life. With the help of psychological strategies, physical activity, social support, and when necessary medical treatments, it is possible to manage and reduce anxiety, really improving your overall well-being.